Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Today, a free program that helps older adults with cancer learn valuable technology skills and can empower them to participate in their health journey. The pandemic's effect on telehealth opened up new ways of care for many patients with cancer. But for some populations, telehealth services can widen disparities. Andrea Conners is the executive director of the Patient Empowerment Network, the organization that created the digitally empowered program.
I was the care partner for my mother, who was diagnosed with a late-stage terminal illness. Towards the end of her disease, she was completely confined to her home. And I saw the loneliness and the mental health challenges, in addition to the physical symptoms that she was experiencing, that were really an incredibly heavy burden for her to carry. My mother was older when she was diagnosed and in her mid to late 70s and didn't really have technology skills. And so I spent a lot of time with her working on, how to access the internet, how to find funny videos that would make her laugh on YouTube, and spent a lot of time doing that with her. And then realized we should be doing that for more people who might not have the skills, but need the skills in order to use technology to their advantage during their cancer journey.
So that led you to create this program. Can you tell us about it?
So we started a program which we call the Digital Sherpa Program, where we utilize digital natives, college students, to offer workshops, hands-on workshops with older adults to teach them how to turn on their computer, how to use their mouse, how to access their email account that they've been locked out of for 6 months because they forgot their email address and didn't know how to reset their password. So we launched that program with the support of Cancer Support Community and Moffitt Cancer Center. We launched that program across the US, and we individually trained individual people, which was, a very low reach, high touch sort of activity. And then we started thinking, well, how can we get this program into the hands of more people? And it's a little bit of a conundrum to figure out how to address a technology or digital issue using technology or digital resources. We took all the learnings from those hands-on workshops that we've done, and we created small, short, fun little video modules that anybody can access via the click of a link to be able to educate themselves about how to use technology to their advantage during their cancer journey.
What are some of the ways that older adults are at a disadvantage in this new environment?
I think that there are cultural and generational issues that can really impede people from finding their voice and feeling empowered to ask questions, to seek second opinions. And we know how important it is with a cancer diagnosis to see a specialist and to seek that second opinion so that you are getting, particularly in this era of precision medicine and targeted therapies, that you are getting the most personalized care as your first line treatment right out of the gate and not as your second or third or later stage treatment. And to your point, there are cultural differences, there are generational issues that really are barriers to patients finding their voice and seeking out the best treatment for their individual diagnosis.
What are some of the challenges that older adults with cancer have, and why is digital literacy, specifically for older patients with cancer, so important?
So, I'd start with saying that the American Cancer Society reported this year that nearly 2 million people will likely be diagnosed with cancer in 2022. And that equates to about 5,250 new cases per day. And of those cases, we know that at least 60% of the people who are diagnosed with cancer are 65 or older. And, one of the things we know about cancer is that depending on the type, the disease can progress really quickly, which is why access to timely and up-to-date information is so critical. In today's digital age, and I think with COVID forcing everybody to really engage more digitally, it's a blessing and a curse. Because we live in this amazing digital age, we have access to a wealth of resources on the internet. At the click of a mouse, we can find information on the latest research, clinical trials, new drug treatments, you name it. But for an older generation, who hasn't been brought up with the internet, the online space can be overwhelming, confusing, and a really different and scary place to navigate. And so, there's an opportunity to require information, but it can be out of reach for many people. And that's really why digital literacy is so important, that we look at it from both an equity perspective as well as from a generational perspective.
How can providers put patients in touch with your program?
Excellent question. So the program is available on our website, www.powerfulpatients.org. And one of the things that we are very actively doing is working with providers, whether they be clinicians, nurses, navigators, social workers, to ensure that they know about this program and that they can very easily hand that program over via a link or a QR code to the patients that they work with. So again, that program is free. It's available translated into Spanish. We hope to continue to add modules to that program and continue to translate it into other languages. Each module comes with a downloadable guide that you can either look at on your phone or you can print, that gives you step-by-step instructions for the things that we teach you in the video.
In the show notes, you can find more resources on the digitally empowered program and how to connect your patients. Next week on Cancer Buzz, free legal help in the cancer care setting to address social determinants of health. Until then, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.